widths.
So the reason we chose melanoma as the topic for our project is because it hits home with me. My mother had melanoma earlier in her life, and luckily she survived. She's totally fine. But she passed along the gene to both my sister and I that we both have just more moles than the average person. So that causes us to have to go to the dermatologist once or twice a year, get our moles checked. And I actually had an issue with that during high school. I had a mole on my back that grew, which was completely abnormal, and they got rid of it immediately. I got surgery, they got rid of the skin, they tested it, it was totally negative for melanoma, so it was fine, but it was a whole situation, and I wouldn't wish it upon anybody. But just to let you guys know more about melanoma, we created a few skits, so here we go. Hey, David, is that you in the tanning bed?
Yeah, just get my tan on
Get
here.
a tan on? It looks good. Do you know the risk factors of using a tanning bed?
No, I don't.
Well, first of all, if you use a tanning bed more than 10 times a year up until age 30, you are at double the risk for melanoma. Do you know what melanoma is? Melanoma is the most dangerous skin disease, skin cancer, and it involves moles. And what it does is, you see a mole and it's abnormal, that's when you go to your doctor and get it checked out. Tanning beds can give you UV rays that are just so harmful for your skin. They can break your skin open, they can cause wrinkles and leathery skin, and it doesn't really look good. And skin cancer is not something you want.
Wow, thanks, Dr. Hank.
No problem. Of course. Hey, how are you?
Hey,
Nice to see you. Pretty good. So I hear you're here to get checked for melanoma.
Yeah, after using the tanning bed a few weeks ago, I had some abnormal moles grow on my arm.
So the 5 things we're looking at when looking at melanoma is the ABCDE method. So basically that means A is asymmetrical, which means a different looking mole than others. B would mean borders, which kind of means like it could go up a little bit, kind of like a mountain plateau type of thing. C is color. That means definitely this mole is definitely just completely different color than the rest of your normal moles. D is diameter, and that's normally about the size of a pencil eraser, but that's kind of fluctuating. And then E is evolving, so that basically means how much your mole is changing. And the more your mole is changing over time, honestly, probably the worse off it is. So let's take a look. This one is definitely the one that's striking it right there. You can see the size. This pen is about the same as a pencil eraser, just a lot bigger. The color is a lot smeared. It's definitely different than the other ones. I think that's probably the one we're going to take a look at.
Thank you, doctor.
Yeah, not a problem.